And I learned for the first time that surgery wasn't always successful for ulcer. This bugged me a little bit. But they didn't think very much about the cause of the ulcer. Well, then about the same time, I had this 19-year-old girl. She, too, had had a perforation of 2 jejunal ulcers beyond the ligament trice. This girl put out 3,700 cc's with, I think, 15 times the normal amount of acidity, 15 to 16 times. Now, that's extremely unusual. And she continued to do that after I'd cut off her fundus, left her a small tube of stomach, and after 2,000 Roentgen units of X-ray as recommended by Palmer here in Chicago. So I knew we really had problems. She had a lot of pain. So we finally just agreed that although she was at a young age, we had to take all of her stomach out. I did find an initial operation, a couple little tumors. Nobody could identify it. Well, after we'd done the total gastrectomy, she got along pretty well, but had her ups and downs. I began to little discovered about 10 years later, and I thought, gee, I'd like to look at that pancreas, because her gastrin stayed, instead of normal at 150, 200, at about 500, and with a secretin stimulation test was about 1,000. What caused it? Because it was felt that the only thing the pancreas could make was insulin. Well, I'd like to think, and I'm probably just having a wild dream, but I'd like to think the gastrinoma was one of the great stimulus for the improved antacid therapy we have today.